This week I've been able to introduce you to several families in Montana that have had difficulties with the healthcare system we have in this country. Now I'd like you to hear directly from them.
My name is Pat Dijon from Libby, Montana. I am a home care provider, but I don't have any health insurance. I simply can't afford the premiums. My late husband Dan and I used to own a 500-acre cattle ranch here in northwestern Montana. We could never afford health insurance, and we were uninsured when Dan was diagnosed with Hodgkin's lymphoma in the year 2000. As Dan's medical bills spiraled out of control, we made the painful decision to sell our fourth-generation ranch. The cancer ravaged my husband's body, but selling our ranch to pay for medical costs really broke his spirit. The medical bills were paid, but Dan died paying those bills with no land to pass on to his family. It's been 4 years since Dan passed away, and I still don't have health care insurance. For rural America, health care reform really cannot wait.
Hi, I'm Mindy Renfro. I live in Missoula, Montana. I've had 4 unrelated breast cancers over the last 20 years, and I've always had health insurance. My first 2 rounds of chemotherapy, radiation, and surgery were all covered by my insurance companies. The 3rd time I had breast cancer, I was a single mom, and even though the insurance went through the oncologist, they chose not to pay for my treatments. They called, apologized, and offered to send a hospice nurse. I was a young, vital, working, early 40s single mom, and I was not ready to check out. I was told if I wanted to start the chemotherapy my oncologist recommended, I would have to come up with over $100,000 in cash. My only option was to quickly sell my home, move my young children into an apartment, and begin chemotherapy. After trying to pay for the extraneous bills involved, after many years, they've started to come after me legally. My husband and myself have had to just file bankruptcy. In January of this year, we'll have to face a judge and accept the bankruptcy. Please don't let this happen to other Montanans.
Everyone knows our healthcare system is broken. No one should be one sickness away from bankruptcy or losing their home. That's where we're fighting to drive down costs, insure more people, making sure healthcare is affordable for everyone, so that folks, when they get sick, won't lose a lifetime of work.